Good afternoon. Welcome to the IEP Workshop. We hope everyone is enjoying NOAA's virtual conference. My name is Jill Gorman, and I will be your moderator and one of the presenters for this session today. Please note that this session is being recorded and will be available for viewing after the conference. Friendly reminder, during the session, please keep your mics on mute. If you have any questions, please post them in the chat during the session. We will do our best to answer everyone's questions today, but we will be providing our contact information at the end of the session if you have any additional questions. We will also be sharing a link where you will be able to access documentation from the session. A short message from the presenters. This session is based on the presenters' understanding of the provisions of IDEA and their implications for children with albinism. It is not intended for and should not be used as legal advice. Topics and suggestions from this session should be individualized for your student and correlate with current assessments. Please consider these as possibilities and not required for each student. Next slide. Again, my name is Jill Gorman. I'm a NOAA volunteer. My family and I live in California. Our son has albinism and is a rising sophomore in high school. Now it is my pleasure to welcome our presentation team for today. Kim?
Hi there, I'm Kim Avila. I am a person with albinism. I've been working in the field of blindness and vision impairment for over 20 years, and currently I'm the professor in charge of the teacher preparation program in blindness and vision impairment at George Mason University in Fairfax, Virginia.
Hi, I'm Ann Korn. I'm a retired professor from Vanderbilt University. I prepared teachers and held a similar position as a coordinator of programs in visual disabilities. And I'm here in Austin, Texas.
I'm Kathi Garza, and I am currently the Family Engagement Coordinator at the Texas School for the Blind in the Outreach Department. So I work with families across the state of Texas whose children have visual impairments and or are blind. And I'm also a TVI as well. I live in Austin.
Hi, I'm Marjorie Wood, and I am an orientation and mobility consultant for around the United States. I have been in the field for over 45 years, and I'm also a teacher of the blind and visually impaired, and I live in Austin.
Next slide.
This is Ann. You're going to be seeing the side of my face because I have low vision and I use a larger monitor to see it. So this session is preparing for the 20 to 21 school year, which brings new challenges for students, parents, and teachers. This session will discuss the dynamics of navigating the IEP process for hybrid, which is partially in-person settings, and remote programming.
Next slide.
Great. And so I'm Kathi Garza, and I'm going to go over a few of the key terms that we're going to use for this session. I kind of like doing that. I guess it's kind of become a thing if you were in the session yesterday about literacy media. So for the purpose of this session, and for anybody who has not started into, if your children are under the age of 3, then you may not have an IEP yet. So we'll talk about that. The IEP is the acronym, one of a billion acronyms, and it stands for Individualized Education Program. So this is a written document that's developed for each public school student who's eligible for special education services. In our area, it would be, primarily vision, but it could be other health impairment, orthopedic impairment, any of those other eligibilities. The IEP is a legal document that's developed by the instructional team, which includes you as the family, your student as well, and any school personnel who are knowledgeable about the student's needs. So that could be the TVI, the comms, a speech pathologist, speech and language pathologist if it's appropriate. So orientation and mobility, O&M, is specialized training that's carried out by a certified O&M specialist, like our friend Marjorie here, which helps a student who is blind or visually impaired know where he or she is in space. So that's the orientation part of it, and where he or she wants to go. And then it also helps them carry out the plan for how to get there. That's the mobility part. SMART goals are concrete targets that you strive to achieve over time. They're usually written in as part of the IEP, and the SMART stands for specific, measurable, achievable, relevant, and time-based. And we'll talk about that a little bit more later. Remote instruction, we've been using words, a lot of words like distance learning, virtual learning during this time of the pandemic, but we're defining, we're using the word remote instruction to define instruction that takes place outside of the school facilities. So this may occur through tangible instructional materials that maybe are sent home, or virtual learning opportunities, which are happening either asynchronous, which means that you're maybe watching something, watching a pre-recorded video or a pre-recorded session, kind of like if you watch the NOAA opening session or the orientation session, or synchronous virtual classes, which would be more like what we're doing now, where we're all here together talking at the same time, or through other digital environments. Hybrid instruction, we're defining that as a method of instruction which blends in-person learning with remote instruction. I'm sure you've been hearing a lot about that from your school district's plans, maybe for reopening, that there may be hybrid models. And then the last one is learning management system, LMS. That's just a platform that helps instructors arrange and organize instructional materials online and conduct online classes. So that a learning management system might be like Canvas or Google Classroom, or Seesaw, any of those like management systems where people are posting content for kids or adults to interact with. And so, hang on one second, I'm sorry. And so we wanted to start off today by just thinking about some ideas for a summer to-do list. What are some things that you can be doing during the summer to kind of start to get ready to think about the upcoming school year and navigating IEPs in this virtual remote format? So one of the things that you could start doing would be to become familiar with the goals, objectives, services, and other accommodations that are already in your student's IEP. Just kind of looking at those things and starting to get an idea of refreshing your memory about what's there, and so that you can kind of go through these next processes. And I'm going to go ahead and turn it to Jill now to talk about the parent progress report. Jill's muted, I think.
Thank you, Kathy. So as you review your student's IEP and reflect on the past school year, consider making notes for yourself based on your observations while your student has been participating in remote learning. I like to call this gathering of information a parent progress report. It's a useful tool of information as you prepare for the upcoming school year or an upcoming IEP meeting. Some key points to think about and include in this report, and again, these are suggestions. First off, documenting the progress your student has made since the last IEP meeting. For instance, you may have observed your student's keyboarding skills have improved during remote learning. In preparing for possible remote instruction in the fall, think about skills your student will need in a new learning model, such as utilizing a mouse or learning keyboard commands. Generate ideas for IEP goals based on your observations of your student. Possibly you notice your student hesitates at street crossings while taking a walk through your neighborhood. You may want to ask for an orientation and mobility evaluation if your student isn't receiving O&M, or discuss a travel goal with your O&M specialist. List what hasn't and has worked well during remote learning. For instance, is your student struggling with navigating Zoom? None of us have been doing that. None of us have been going through that. I think we've all been experiencing that one. Or have you noticed that their visual fatigue has increased? List questions, all your questions, about how remote or hybrid instruction aligns with the IEP, so you can discuss those questions with your IEP team.
Preparing for the IEP and the start of school. So we're just going to go over these next points in further detail. So we're going to talk about proactive advocacy. We're going to review some skills checklists or skills ideas for students. Talk about services in the general education setting. We're going to talk a little bit about writing SMART goals and adjusting those goals to accommodate for remote learning. And then we'll talk a little bit about safety with social distancing.
Okay, so I'm going to talk a little bit about some considerations. So as you work on what Kathy and Jill were talking about, a summer skill checklist, some things to prepare you for fall. There's some items kind of related to how schools are going to function in the fall that we need to be cognizant of and start preparing for right now. And so as you may be aware, some of your schools may be doing a hybrid model. They may be bringing students on campus. They may have virtual and remote learning, but if they are going to have on-campus elements, there's some accessibility elements that you can really consider and help advocate for now. So a couple of those things are, first of all, a lot of schools are installing different types of plexiglass barriers, which are very difficult to see, and I'm starting to get a lot of folks who are submitting pictures to me that are showing the plexiglass barriers start at a different place in the classroom that our students may not be familiar with. And some of them are darting out past the reception desk, and they are a collision hazard. Even if our students have canes, they can be a collision hazard. So we want to make sure our schools are ADA compliant in the way they're installing those plexiglass barriers. And then another suggestion is to also have your school use some type of tape to outline the plexiglass so that our students can see it. And this isn't just for our kids with albinism. There's plenty of sighted students, plenty of sighted teachers who have, can pummel into those barriers and, create a little bit of a safety hazard. So it's a good time now to start working with your administrators and to make them cognizant. I've met with a lot over the past few weeks to help them make these plans and preparations, because sometimes we're just not on their radar, these accessibility components. The other thing, if your school is purchasing social distancing markers, we want them to be high contrast. They may need to be tactile so that your student can feel it with their foot or their cane. By high contrast, what I mean is if your school has like a cream colored beige floor, tile floor, we don't want to have yellow social distancing markers placed on that floor. It's going to be very difficult for a lot of students to see. So a high contrast, something that gives a good amount of contrast between the surface that it's affixed. So do take this time now to start communicating and making sure this is on the radar. Our schools are purchasing these devices right now and installing them before fall. For a lot of our kids, and my kids included, they will be accessing remote instruction. They either in some capacity online, or they will be in a virtual setting for their entire week or for at least part of the week. And if you've attended my NOAA sessions in the past, you know the two things I always advocate for are being proactive in our approaches, but also accessibility. And so accessibility is a key element right now. And our schools, again, they are purchasing the platforms, the computers, the devices, electronic textbooks, memberships to different types of apps and content entities that provide helpful instruction. So we want to make sure those are accessible, especially if your student uses things like a screen reader or a braille display or any type of other assistive devices. Next slide. Okay, so accessibility is a really key element to the way that our students are accessing things. And a lot of us with albinism, we're pretty perseverant and determined, and we will put ourselves in the most awkward positions to be able to engage in our content, because it's important to us to do our best and to also exemplify our skills. The challenge is that a lot of the programs that we're required to interact with are not digitally accessible. And that is a challenge. We both have, there's federal guidelines and there's state guidelines that all of the United States have to comply with to ensure things are accessible so everybody can access them, especially people with disabilities. But this requires some proactive training and planning on the parts of our schools and also for us. So next slide. So these are just some ideas. I really advocate for helping your school systems understand that your student can benefit from accessible text, from computers and devices and apps and programs that are accessible to them. And so I did put in on this slide and then in the resources some links that you can share with your school teachers to help them prepare accessible content. So what I mean by accessible content is we had a teacher, fabulous teacher who this past semester wrote up the schedule. She made it in a nice table and formatted it beautifully. And then she took a screenshot of that table she made up and sent it out to the class as an image. So that image is not accessible to a student who needs to use different technology, if they're using a screen reader, a braille display, if they're using any type of other devices to access that. And it's not just our kids with albinism, it's kids who have dyslexia, kids with convergence insufficiency, print disabilities, reading disabilities, and the list goes on. So Microsoft has a great training to help teachers learn to author accessible content. And you may be not quite understanding, because accessibility is a huge topic. We could spend hours on this, but when we have materials that are accessible to us and we are well trained on our devices and how to access them, for me as a person with albinism, this was a game changer. This alleviated a lot of the fatigue I get that I didn't even know I was experiencing, again, because we're perseverant. We are going to do our jobs no matter what it takes, but there are more effective and efficient ways to do that. There's some links here also to how to create accessible presentations that are really good for teachers to watch, because they are going to have not just our kids in the classroom, but they're going to have other kids with dyslexia, with other disabilities that benefit. And then Universal Design for Learning is also a great framework to share with our schools and our teachers, because it integrates that theory that if we embed accessibility and a more universal access model, more kids are going to benefit. Next slide. Okay, so I really want you to think about with your IEP as you're advocating, and nothing we say, like Kathi and Jill had said, nothing we say, this does not reflect all students with albinism. This is merely just to get that dialogue started with you and your family, and then when you go to the school, so you can ask these questions. But really look at, is your student being efficient in the way they access everything? So you can't see it right now because I have a picture of the conference room we're supposed to be in right now on my virtual screen, but my computer is set up that I have an arm on my monitor here, so I don't have to slouch over. I also have multiple types of assistive technology on here that make me more efficient in my job and also alleviate a lot of the challenges that I have with neck fatigue and headaches and eye strain. So we really want to think, is your student efficient? Now, your student may be a straight A student. Your student may be the kind of kid that will spend all hours of the day reading and doing things, but that doesn't necessarily mean that they're being efficient and effective. There may be better ways. So next slide. Okay, so when I say that there's other technologies to consider, so again, a lot of people with albinism, we do have usable eyesight and we try to rely off of that, sometimes a little too much, and that can cause us to be less efficient. But with PCs, there's screen readers, JAWS, NVDA, and you may be thinking, and your child may be thinking, well, that's great for people who are blind, but honestly, these screen readers are used by actually a lot of different people. Windows Narrator, Read Aloud extension on Chrome, and they really help access and also help you find typos. If you have to read really long, boring things, it really helps you get through it. The Mac has VoiceOver. Our tablets and smartphones, Androids have accessibility features, the iPhones and iTablets do as well, and then also access to refreshable Braille displays. So if your student is a Braille reader, if they are learning Braille, refreshable Braille has made it really easy for me as a TBVI to make sure my students have better access. But this is all dependent on our schools purchasing accessible textbooks, accessible platforms, different types of documents and curriculum and instruction. So if I get that, if our school system gets these in accessible accessible format. My student who uses that refreshable Braille display, they can access it instantly. My students who use the assistive technology, they can access it instantly. For me, as the person who's VI, I can also work through it more effectively with the different technologies. So again, we're not saying any one technology is the technology for a person with albinism, but there's a lot out there, and we don't have to, spend our time straining our eyes, and we can use our toolbox. Next slide.
And Kim, sometimes there's a time and a place too, like
Yes.
you might only use those features for certain tasks.
Yes.
Maybe you have Zoom text read documents to you at the end of the day for homework because your eyes are tired, but you might not do that in the classroom, So I think that's a really good point you're making, that it's like there's a time and a place for all of that.
Absolutely. And Kathy's 100% correct. It's a tool in your toolbox. You use it when you need it. A lot of our kids are taught to use the mouse. And so for some kids with albinism, we can bump up the size of the mouse, we can put a trailer on it, but actually using the mouse is very ineffective. And my husband's a programmer, and he and his programmer friends talk about how they don't actually ever touch the mouse because it actually takes away time. Using keyboard commands is a really great way to access the system. So I was at a dentist office a few months before the shutdown, and I couldn't see the mouse. The screen was too small. I used keyboard commands to navigate because I know the Windows keyboard command. So I was able to fill out, and then I was also, because it was a Windows-based computer, I was able to turn on the different accessibility features, and I filled it out, which was good. So learning keyboard commands, learning the shortcuts is extremely helpful. It's highly efficient. It really alleviates some of the strain that we experience. If your student is using an iPhone or an iPad, using gestures with voiceover is also extremely effective. So as Kathy was saying, sometimes you're going to have things read to you, sometimes you're not. So maybe there's an article that I have to read on my iPad. Maybe it's not the most visually accessible, but I can turn on voiceover and I can use the gestures to read that article to me. Then if there's something I need to see visually, I can zoom in on it or whatnot. So in thinking about going forward in fall, so if your kids are going to be online students, if they're going to be remote, they're going to be accessing platforms similar to Zoom, they're going to be accessing all of these things. This is a wonderful opportunity, and I can't tell you enough as a university faculty member how many people we get who are disabled and are not disabled, who do not know how to interact with our online systems. And so this is your chance to really, this is going to prepare your kids for college, because we do, even before the shutdown, we do so much of our classes with an electronic element. So I started literally just writing out what skills are needed, because I've run an online program at a university now for several years, and I started writing out the skills that I want my students to have when they come into my program, whether they're blind or not, whether they have a disability or not. But what I did is I made this little table, and literally this is a rough draft. I've just been putting things in there as I think about it, and you can use it as a framework to gauge what can my student do right now, and what might they need an IEP goal on. So we're in this platform learning to mute and unmute your microphone with the keyboard command, learning how to where to submit assignments on that Google Classroom, using accessibility features in that Google Classroom or Blackboard or Canvas. So that's just a little sample of things, so you can think about it and you can talk to your students' TBVI. Is my student skilled at these? Do they need to learn keyboard commands? Do they need to learn how to access this with NVDA, with VoiceOver, or the Braille display? So we did link this in the resources, so that's available for you to download and just to take a look at. Again, it's rough, it's nothing fancy, but it also includes a column for pre and post, so you and your TBVI, your student's TBVI, can kind of track progress, and then also make sure that all the skills needed that your student's doing. Next slide.
Kim,
Hi.
Before we move forward, this
Okay.
is Jill. A couple of things that are showing up in the chat, but I'm wondering, before we go into IEP services, could you possibly define for the group the difference between 504 and IEP?
Sure. So IEPs comes out of the Individuals with Disabilities Education Act. When you refer your student, so we're talking about albinism. When you refer your student for eligibility for special education services, they go through that assessment procedure and they get their functional vision or learning media and all the other evaluations. If the team finds that there is educational impact on that student's access to education, they will get an IEP, which is under IDEA. And that means that they're going to need some type of some more than accommodations. So if we find that there's no educational impact, but maybe we just need to change the lighting in the room, maybe they need to have access to some accommodations, but they don't need any specialized services or instruction, they would get a 504 plan. And there are kids with albinism who have 504 plans. Some families are happy about that. Some families are not happy about that. With IEPs, we have found that there's educational impact on that student and we need to provide specialized instruction and services. So they're going to get a TBVI who comes in, whether it's consult, where they come in, you know, twice a month and consult, or maybe they're getting VI services multiple days a week for a few hours. So the IEP does show that there is impact. We have to set goals in an IEP to maybe we're going to work on those technology skills. I'm going to teach that student how to access Blackboard with their assistive technology and with keyboard commands. My student with a 504, maybe all we need is some change settings on there on the computer, you know, to increase contrast or decrease glare, things like that. So that is a team decision and you do have a say. If you feel that there's impact, you do have a say on that.
Thank you, Kim.
Is there another question?
There is another question. It is concerning accommodations,
Okay.
and in particular SAT and ACT. Did you want to take that now, or should we, or maybe we have some
I think there might even be like Kathi or someone may want to chime. It's up to you all. I'm flexible.
And basically, they're looking for anybody who can address what accommodations are possible for taking the SAT and or ACT.
Okay. Kathi, do you want to chime
Well,
in?
I did have a parent this year call me about that. And one of the challenges they were facing is that the accommodations weren't, the accommodations that the student was requesting were not necessarily being used in the classroom and they weren't in the IEP. So I think that the accommodations for the SAT and ACT, you can discuss with you can look on their websites to see kind of what are some things that are available. But the really important thing that I got from that situation, and I think Kim is probably way more eloquent at saying this than I am, but was like, to whatever you think they're going to need on the ACT or SAT should be something that they're already using in the classroom. And so if you're asking for extended time, but they don't have extended time in their IEP and or they're not using it, then it's a little bit harder to justify that, I think. And so for me personally, I never had accommodations on those tests because it seemed like the hoops to jump through to get them were outweighed, you know, what I needed, you know, but I think it's just really important that they're documented in the IEP and that you're not asking for things, you know, if you're asking for magnification devices on the ACT, it should be something that they already have and are already using in their classroom for those things. You have anything to add, Kim?
Yeah, and you're right, you're absolutely right. It needs to be in the IEP. And it also, if you are doing extended time requests for the SAT for College Board, then the amount of time needs to be documented in the IEP and it needs to be in there for at least a year. So if it's 100% extra time that your student uses for biology exams, for the state exams they take, it literally needs to be written on that accommodation page for ETS to consider that. And then if you need large print, you need to specify what size. So we've had issues with ETS sending us the large print exam. It's the large paper with literally 14 fonts. So if your student needs 18 font or something like that, that needs to be clarified. If your student is a Braille student, that all needs to be, there's a whole story, not going to get into it today, about requesting the Braille accommodations, if they need changed lighting, if they need assessment in a single room so that they don't have that outside glare, put that in the IEP. My daughter just got approved for her SAT accommodation. She also has low vision, and you know, our case manager put it all through, but it was all in the IEP.
And I think as a parent, and piggybacking on what Kathy and Kim are saying, you know, one of the things that we're experiencing as parents is that just working very closely with your IEP team and the person who is in charge at your school in assisting students with being set up for the SAT. And yeah, just planning ahead.
Right. So Jill, do you want me to go on to IEP services?
Yes, please.
Okay, so we want to clarify, we can't tell you what services your student with albinism will get. That is not up to us. That is your IEP team decision. I'm just going to give you some prompts to help think about, we're going into next year. My school system said every child with an IEP, we're going to have IEP meetings before school starts because we have a choice between hybrid or completely online. And so we're going to be having an IEP here in the next month. And so some things that I'm thinking about, because both of my kids have low vision, are how are they going to get VI services? So they're going to be remote. I'm putting my kids in remote and not in a hybrid. So with that remote setting, and we are getting a lot of feedback, just so I think there's a couple people unmuted. How are they going to get VI services? So we're probably going to opt that the TVI is going to do the VI services via web conference. We did that last semester, actually worked out just fine. But your student might get different services. So you might have heard the term push-in services, which in IDEA is defined as services in the general education setting by that special ed teacher. So historically, in our previous normal, the TBVI might come into the classroom, observe some things, provide some prompts, help the student with their IEP goals in that general education classroom. If your student is going to be remote, that's going to be very different because they're not going to be able to talk to your student directly. We also don't want to interrupt general education. So please talk with your school system. How is that going to look? How are we going to actually be able to do this service? And I can't tell you this is the way your school is going to do it, because every school is going to be different, and they're still inventing the answer to that right now, literally as we speak. So, so those are some things to consider. You might have a student who will be in the classroom. They get the services from the TBVI. So if I go into a classroom to work with a student, I usually sit next to them, or sometimes I sit across from them or wherever. But you know, sometimes we have to give them tactile cues. Sometimes we have to help with their materials and whatnot. You're going to want to talk to your school system. What does that mean? My child does need those tactile prompts. They do need that hands-on service. So you need to talk to your school system, because I can't tell you this is the precise way to do it. Every school system is going to have differences. So some school systems have already said if it's a student who needs close proximity, we're going to provide them with extra PPE. We might have a plexiglass barrier, but again, I can't tell you the answer because you need to ask your school. So be sure you ask. Braille. So some kids, I know some of you, some of the families, I recognize some of your names, and I know that your kids are getting Braille instruction. And when we teach Braille, the little ones, a lot of it is that motor skill that we have to think about, and it's very tactile. We teach them parallel method, we teach them scissor method to read, we make sure they're not scrubbing too hard. So I oftentimes have to have my hands on the kid to do that. But I will tell you, we can't do this remotely. I've been in the field for 20 years. We've had families that I've had to talk it through on the phone over the summer because the child was regressing and they were already done with ESY. So we can do some things. So you want to talk to your school system. How can we do this safely and effectively? I think that's it for mine. Yeah, oh, so I just put some other ideas in here. You know, if you are doing the remote version, make sure your school complies with FERPA, that your child's privacy is taken care of. We actually had a huge FERPA violation, long story here, and it was pretty bad. But so there are some things we can do as TBVIs. I can go in, I can observe a remote class, I can log in, I can have access to that and help come up and devise methods for that student to be equitable in their access, also help the teacher with that accessibility and the accommodations. So I think that's it for me. Yes. Okay.
And just for those of you who may be new to IEP and the process, in the resource folder that we'll be providing a link to at the end of this session, it will include a one sheet on IEP basics. So, Margie?
Okay. So right now we're going to talk about how we can tailor SMART goals to accommodate for the remote learning environment. And just to reiterate what Kathi was saying, I'm going to review SMART meaning specific, measurable, achievable, or attainable, depending on who you're talking to. Same thing, relevant and timely. Next slide. So we're going to look at a sample goal for a minute, but before we do, I wanted to explain a little bit about orientation and mobility for anybody who may not be familiar with it. Kathi touched upon it, and so did Jill. So I wanted to explain that it is a related service for students who are visually impaired from the ages of birth to 21. The way they receive the service is that they will have an evaluation by an orientation and mobility specialist. I saw in the chat box, what is COMS? And that, yes, Certified Orientation and Mobility Specialist. There are two certifying bodies in the United States, NOMS, which is, comes from Louisiana, and then COMS, which is a major, is the larger of the two certifying bodies. So also I wanted to let you know that there's an O&M information sheet in the resource link as well. So you can find out a little bit more about O&M. And another thing I wanted to touch upon that Jill had mentioned was if your student is not receiving O&M services, or even if your student is, and you have over this summer or over this time period, when you've been traveling with your students somewhere, you've noticed that they may be slowing down at steps, or terrain changes, or lighting changes, or at street crossings, or whatever. You can go ahead and ask the IEP meeting, at an IEP meeting, to have an orientation and mobility evaluation, so that you can see if the student needs some O&M instruction. And oftentimes, unlike VI instruction, O&M instruction may come in for a couple of, a year or two, and then your student is age appropriate in travel skills, and then later, maybe a couple of years later, or whatever time is necessary, you see, we're not age related and we're not age appropriate at this time, and we come back in. So again, it's always tailor-made according to your students' needs. All right, so we're going to look at this O&M goal for a minute. And again, what we're looking at is that it's basically by the end of the school year, the student will independently plan and execute a route and reverse it in a neighborhood. And I'm going to lose my voice. Sorry. We've got a lot of allergies around. Anyway, one of the things that I wanted to talk to you about is in instruction with O&M, just like VI, it can be virtual, pretty much virtual, or it can be remote if it needs to be. But one of the things we want to caution is anytime your student is traveling, if it's a younger student traveling indoors and there's a safety issue, you need to be with them, or a parent should be with them. Same thing for outdoors. A parent should be accompanying the student during the O&M instruction. Okay, there you go. Thank you. All right, so now we're going to we looked at the goal, by the way, the goal, and I have benchmarks for that particular goal. They will also be in the resource link. So here we have prerequisite skills to attain that one particular O&M goal, just to show you, if you're not familiar with O&M, how many different skills are needed to attain that particular goal. I lumped them into 5 different groups, and there's orientation skills, outdoor concepts, intersections, visual skills, and assistive technology. So let's go to the next. Thank you. We're going to take one of those skills, and it's orientation skills. And that's one of the things about an orientation and mobility. Orientation is our niche. Very seldom will a student learn about landmarks and clues, if at all, in any other setting in the school setting. Address systems, map skills, problem solving, use of other senses, and soliciting assistance. And in that soliciting assistance, we also, when you're asking for assistance, learning to know who is safe and who is not safe in order to approach and ask those specific questions. Also in MAP skills, that's very, very detailed, and there's a process in learning MAP skills. These particular skills, there's so much that you can do during a mobility lesson, but also away from that mobility lesson that can support these skills and reinforce the skill, knowledge, and abilities. Let's go to the next slide, please. Okay, hold on a second, I'm having trouble there. Okay. So what I wanted to show you also is that family activities. This kind of coincides also with PE. I don't know if you'll, like Kim has been saying, we don't know what the schedule is going to be like. Every school is going to be different. Every state is different. But this is an opportunity, and I'm sure you all have already been doing things like this. And we see families walking together, biking together, playing skills out in parking lots together. It's wonderful to watch all of this, but there are so many of those skills that can be incorporated while you're walking and biking and hiking. One of the things you can do early on, very young at age, is starting to talk about traveling when you're in the car. So many times we have, if you're not the driver, anybody sitting in a car oftentimes doesn't pay any attention to the route, to anything. I mean, that's normal. And that happens with our kids. So we're almost like, beam me up, Scotty, or move me, whatever, from one direction to another. We can start teaching at an early age about the environment out there, and learning all the things that are, all this environmental concepts. It's really phenomenal. So these both, I've got some more pages in the link, and it's really phenomenal to, you can look at it at age appropriate activities that you can do, more specific activities that you can do. So just as an example, I wanted to give you, for instance, if you're walking in the neighborhood and you make a turn to go right or left, whatever, you can talk to them about, that's a great landmark opportunity. If you're going to reverse a route or whatever, they can use their phones to take a picture of that landmark, or they can go ahead and learn to use it, their voice, and talk about what the landmark is, so that they can help find the way back home. One of the things I didn't bring up is when you're having an O&M lesson that is a remote or virtual lesson with the O&M instructor, you can use the phone. You can also use the iPad or tablet that is connected with the O&M instructor to be able to be on the lesson with you, so that it's that virtual lesson. All right, and so the next, let's go to the next slide, please. So now we're on, whoops, I'm sorry, I did that. There we go. Safety and social distancing. So again, Kim talked about some of the things that are, we've seen all the plexiglass when we're going somewhere. One of the things that with the plexiglass and the social distancing markers, to be able, what you can do, when you find out what the parameters are or the protocols for your school are, see if you can have an opportunity to go into that school and with your student and be able to talk with the office staff, whomever, and find out if you can go through the school with them. Now, if they're receiving orientation and mobility, the O&M specialist might be able to do that, but I recommend you also going along as well, because things may change, within a week, and it's really good to be able to take that home and talk with your student about how are we going to, problem solve some things? How are we going to figure out the 6 foot distance? You can use things like pool noodles, or you can, if they're using a cane, what's that distance, and practicing that distance. A lot of our students have depth perception issues. So you're going to have to, role play and problem solve. And a lot of times our students are really good about giving some suggestions that, we as adults, we've lived how many years, and they're going, they've got some great ideas for that. Also, are there meetings, parent meetings, PTA or community meetings that may be talking about what the schools may be doing to implement and wanting some input? The other thing is on those social distancing markers. See, if they're on the floor, sometimes they're going to get scraped, come off real easily. In 2 days, they're gone. So are they on the wall? Are they, they may get peeled off the wall. But again, just some way of being able to see if your student can visually or tactually use them. Let's see, I think that's it. Anne?
Okay, we're going to talk about instruction and social distancing. Remember that the IEP is in place, and schools do not have a reprieve from using or altering their IEPs to suit your student. Supports are going to be needed not only for accessing, but also for receiving instruction while social distancing. And general education teachers may be new to your student. It's a new school year. It may be moving from 6th grade and 5th grade into a middle school. It may be moving into a high school. Totally new situation. And we know that the TBVIs may not be able to visit with general education teachers because of the general education teachers' schedules, or because of the TBVI schedules at the very beginning of the school year. So parents may need to step up to the plate and actually explain to new teachers what low vision is all about, and share with them that for all students, they may like to be close to each other, but for a child with low vision, they're actually taught to reduce distances to increase their visual functioning. Get closer, try to look at facial expression. There are ways that just come naturally to a child with low vision that the general education teacher who knows nothing about low vision may not be aware of. Consider that all children work closely together during instruction. So let's say a child with low vision knows that they can see a demonstration when they stand next to the teacher. Well, they may approach a teacher and a teacher may want to move away from them. And all of this is going to take a lot of patience. Next slide. When we're talking about distances, we're all talking about 6 feet away with social distancing. And this is a way I've used to explain to teachers what this acuity really means. So we know that a child with 20/100 acuity can see at 20 feet what a person with typical vision sees at 100 feet. We know that a child with 2200 can see at 20 feet what a child with typical vision can see at 200 feet. Well, we can think about that in reverse as well. So let's say a child has 20/200 acuity and they are 6 feet away from someone. For a child with typical vision, that would be like standing 60 feet away from the person they're looking at. And that's approximately 2 lengths of a classroom. This year I was in a classroom and actually measured some lengths before we all had the shutdown. And they were like 28 to 29 feet. And so about 30 feet I'm using. So also, if a child is on markers and one child is at 6 feet and the next child is at 12 feet, that's the same as a child standing about 120 feet away, and that would be approximately 4 lengths of a classroom. Now, in these approximate distances, I have not included the idea that some children have photophobia. They're going to be very sensitive to light. And when light enters the situation, these distances may actually be in effect a little further than we would expect. So, and I know that lighting has a very different experience for different children, but you know your student and how lighting affects the improvement of images or the degradation of images. So let's go to the next slide. We're also going to talk about peer relationships and social distancing. And supports are needed to encourage peer relationships while we are all being told to stay at least 6 feet away. So consider distance as an important factor in establishing peer relationships as well as student-teacher relationships. Consider the potential social and psychological impact of extending social distances. There could be additional stresses for not only the teachers who don't want to get close, but for the children who want to get close to their teachers and are being told not to approach. Now, some of the devices in classrooms may be helpful. We may be using video magnifiers, which are desktops and have distance options for seeing at a distance of what's happening 12 feet away, 15 feet away, and so on. And the old handheld monocular telescope, or a pair of bioptics may also be helpful, and children need to develop skills with regard to that. The main message is, I think at the beginning of this school year, everyone's going to need to be patient with each other, patient learning new skills, and also patient when the school system is telling you something that they may not have full information about. The main point is your child's IEP is in effect, and if there are changes, you need to ask for a change in the IEP, which means an IEP meeting, and please don't hesitate to do that. Next slide, please. Remember that all teachers have issues with social distancing for the child with low vision. There may be misinterpretation of another's communications. There may be feelings may increase when a peer doesn't want to come closer also, not just the teachers. Students may worry that they won't receive the help that they need, and patience is needed by all. Next slide. And I think that's the end of my section.
Thank you so much. Thank you to all the presenters today. I have added the session resource link in the chat room. I know we're getting close to the end of this session, but I also wanted to share with you all 3 upcoming sessions that will be held through Parent Connections and Grandparent Connections. I will share those in the chat. I think they're here, so you can take note of that. Let's see, we do have a question too. How effective do you believe O&M instruction can be virtually? Margie?
Okay, well, I think it depends on a lot of factors. I think it depends on the student, what's being taught, how frequent it's being taught. Are they asking you to come in to help reinforce those skills when the student is not receiving O&M services? That's just right off the bat. It's, you know, it's not ideal, but some things like, you know, I've been talking to other mobility instructors, and they've said basically that they're doing map skills with their totally blind students online, you know, using Zoom. So it just, again, it depends on what skill level. Now, when you're crossing streets and everything, that's where you're going to have to, as a parent, really learn and understand what the skill is that the O&M instructor wants to see. And, you know, that would be, I'm glad you brought that up, because I would recommend that you make sure that you put that in an IEP saying how it's going to look, and make sure that you've got some direction from that O&M instructor, and specifically, you know, what's it going to look like from them, because you don't have that training unless, you know, so you need that information. Does that help?
Thank you, Margie. I know there are a lot of unknowns for many of us, depending on where we're living in and what the situation may be in your particular district.
I wanted to add to that. Ann Korn and Penny Rosenblum have an updated version of their book, Finding Wheels, coming out. And so I know a lot of mobility instructors are looking forward to the release of that book from Ann Korn and Penny, because it does talk about all the transportation options. And it's a great way to, I mean, the previous book was awesome. So Ann, I don't want to speak for you, but.
Well, I'm glad you raised it, because I didn't feel comfortable doing so.
No, I meant to
if
do
you
that
have a
too.
teenager or a young adult, you know, this is something that does not replace orientation and mobility instruction, but it's all those skills that someone needs to become an efficient traveler. It also has one chapter on low vision driving. If you have a teen who meets their state's vision requirements and needs to learn about bioptic driving for low vision license. This is the kind of book that parents can go through with kids, teenagers can read on their own, or an O&M instructor can also do with a group of children through a Zoom.
Very good. Thank you, because I had it on my list. So I'm glad you said.
Thanks for bringing it up.
This is Kathi. Like, I think that, and I can't speak for Margie because I'm not a comms, but I think that just being creative during this time is going to be really important. And so there's so much more to O&M than just holding the cane and moving it left to right and crossing a street. You know, it's all of those things, like Margie was saying, you know, teaching directional language, teaching north, south, east, and west, teaching address systems and map reading skills, which also is really helpful for geography and history and other subjects as well. And so I think that it goes back to what we were kind of saying at the beginning, where, you know, one of your things to do this summer might be to look at those IEP goals and say, okay, well, you know, maybe we're really not going to do cane skills right this minute, or maybe we're not going to do complex intersections this semester like we had planned, but we can, you know, we can talk about traffic patterns, and we can practice listening for those things safely, you know, in the remote learning environment. So I think it's just really getting creative and brainstorming with the team about what are some equally important O&M skills that we can teach now in this setting that we maybe can't teach the other ones we had planned on.
We always say that orientation mobility is everything, and everything is orientation and mobility, and it really does relate and connect with it so much. And thank you, Kathi, for bringing that up as well. So yeah, and especially soliciting assistance. We have, most of our students have a lot of trouble talking, you know, and first of all, just being able to ask a question on the phone, learning to be able to just call some, you know, business and get information that way. It's really great. So all these skills will help to be an independent traveler.
And when is the possible date of the drop of the new book?
Oh, I don't know. It's at the typesetter now.
Okay.
And so my sense is it's probably going to be September, but
okay. People are interested.
My email is up there, and anyone who sends me a note, I am happy to let them know when it is ready.
Thank you, Anne. And everyone, again, I will post the URL for the resource folder for this session. And in that folder, you'll also find our contact information. If you have any questions, please, please, please feel free to contact us. Again, oh yes, Margie.
I just wanted to add to that. You said we were also going to add some more to the URL, right? We're going to have some links to it to add more information.
That is correct. So even if you go into the folder today, Check it in next week, probably the end of next week. There may be some additional information in there, like Margie says, some links to additional resources that you may find helpful. Okay, thank you so much, everybody, for joining us today. Thank you to all of our speakers. We hope you all enjoy the rest of the NOAA virtual conference and have a wonderful day.